Dr. Momo Osezua, clinical research professional, Ontario, Canada, joins us now. Good to see you, Dr. Osezua. With this latest decision, would you say that Canada is better able to prevent outbreaks of COVID-19 infection?
Thank you, Millicent. The truth is, from the data we have so far, I think the government, I can possibly tell you that the government and the public health authorities, data shows that yes, we are able to contain, further spread of an outbreak, basically with this announcement coming in and taking effect from today.
Yes, do you really see incoming and fully vaccinated travelers without increasing the risk there is to health and safety of Canadians? Because even in these parts, we've also seen that after the tests and after vaccination, they've also caught on. And, there have been cases where people are said to have absconded. So, how are they going to check all of that and sort of stop, further spread?
So the measures that have been in place, if we look at the data, the measures that have been in place since February, there's been the compulsory testing at the airports or the points of entry or the border entry points, and then there's also been the issue of quarantining for at least 72 hours in government designated centers. Now that happened all the way from February to August. Now, if you look at the data from August, when the measures for quarantine was eased, that the 72-hour compulsory quarantine measure was eased in government designated facilities, we're also seeing that not much of the source of infection came from travelers. It was not from travelers. In fact, it's so low right now that I think last week's data only showed that 5 people were positive from almost thousands that came into the country. The data in August is already showing that it's less than 2% that is of the source of infection is coming from travelers or outside Canada because of these measures of border testing, coming with fully vaccinated individuals, and also having your pre-boarding COVID-19 for at least 14 days, strong. 72 hours strong before you get on board on the flight. So those things have shown that really it's not the source of infection has not been the traveling. So if we continue the measures of at the border of making sure that you get tested, so what we call surveillance testing, and right now the measures for 72-hour quarantine has ceased, but it's still mandatory that you do a 14-day quarantine after you have left the borders and you have got into the country. And with these measures, we think that infection rates from travelers would not be a problem at all.
So let's look more within, and this is Canada. I mean, cases are still rising, but not as high as the beginning of the pandemic.
Yeah.
But has illness severity, hospitalization reduced with, the mass and rapid continued vaccination?
So from the data right now we have, especially in a province like Ontario, what we have seen is that there's a clear increase in the number of cases we've had over the past 3 weeks and probably past 4 weeks thereabout. But of course, by extension, we'll see that there's also an increase in the number of hospitalizations and what have you, the illnesses and hospitalizations, maybe even severity. However, what we are noticing is that they are still within manageable limits. Unlike what we had in April, when the health resources were stretched. People were taking double sheets and staying weeks, or there was just this massive outbreak within the healthcare space. So that is not so much of a problem right now. It's being managed, and the important thing we're also noticing is that this is manageable because of the vaccines. Because if you take a sample from what we have seen, 85% of those in the ICU, for example, are currently those that were not vaccinated. So the remaining 15% were actually from those who are taking the first shot or at least 2 doses. And then there are some that are just in the hospital and not in ICU. Same data applies, 75% and another 25%. So it's showing that with more vaccinations, we might actually not see severity of it. We might have cases, but it's not severe and it's not requiring any hospitalizations.
All right. Finally, Dr. Osezua, with children going back to school in Canada, what are the approved vaccines for them?
Yeah, so for now, what we have is the Pfizer vaccine and the Moderna vaccines. Now, The AstraZeneca vaccines, as you mentioned, you listed out, I think there are about 5 currently on the for Health Canada. That's what's approved. The COVID Shield vaccine, that's one of the from Serum Institute of India. However, what we know now is that Moderna and Pfizer are currently what we have available for persons under 55 years. Now, AstraZeneca is also available, but it's only available for those above 55 years, and that's because of what has been in the media with regards to the clotting. So the health authorities here decided to avoid that risk, within that age group of less than 55. We're going to stick with just we're going to stick with Pfizer and Moderna for that age group, and anybody above that age group can have 3 of those vaccines. That's Pfizer, Moderna, and Pfizer, Moderna, and AstraZeneca. So that's what's happening now for Johnson & Johnson. We currently do not have that in wide scale for the public use. We also do not have COVID Shield, which is the Serum Institute of India SSI. We don't have that for public use, but they are approved in Canada. And of course, if you are traveling with those evidences, as you're fully vaccinated, you'll be allowed into the country. Currently, what is for public use is Moderna and Pfizer, like less than 55, and then the other 3 above 55. Yes.
All right. We always appreciate your time on the program. Continue to stay safe. Thank you so much, Dr. Momo Osezawa, clinical research professional, joining us from Ontario, Canada. Thanks.
Thank you. Thank you, Vincent. Bye.